According to ASHA's most recent report on SLP employment statistics in 2022, around 39% of SLPs are employed in healthcare settings. SLPs who work in healthcare settings are commonly referred to as medical SLPs or MedSLPs. What does it mean exactly to be a MedSLP? Is the medical side of our profession right for everyone? More importantly, is it right for you? Stick around as I share with you 3 things to consider when deciding whether or not you should become a MedSLP. Let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Number 1, what kind of work schedule are you looking for? This is a point that I wish someone had discussed with me when I was a grad student. If you work in a school setting, you get weekends, holidays, and summers off. If you're in a hospital, nursing home, or other medical setting, you are much more likely to work holidays and rotate weekends with your colleagues, and of course, no summer breaks. Requesting time off for a vacation can come with its own challenges, particularly if you're the only SLP serving the building and have patients that absolutely need to be seen. Insurance reimbursement requirements can add to this challenge. For example, a friend of mine once worked in a skilled nursing facility and wanted to take 1 week off to go on a European vacation with her good friend. The director of rehab told her that as long as she could find someone to cover her patients that needed to be seen that week, sure, she could go. Her caseload was low that month, and most of her patients could meet their Medicare minutes with PT and OT, who agreed to take on extra time to help her out. There was one patient on her caseload, however, who was only seeing speech therapy and was on Medicare. In order to remain on my friend's caseload, someone had to see her for at least 30 minutes that week per the Medicare guidelines at that time. PT and OT, of course, couldn't help out, so my friend reached out to other SLPs who worked for the same rehab company within a 10-mile radius, and no one could cover. She and several of her friends wound up posting a plea on Facebook to see if any SLP within a reasonable distance who worked for this company would be able to commute to this facility and cover just 30 minutes of therapy that week. Not a single SLP was able to do it. Ultimately, my friend had to stay back and miss an entire week of vacation, all because of a 30-minute therapy session that she couldn't find coverage for. If weekends, holidays, and vacations are a top priority for you, and good for you if that's the case, then the medical SLP career path may not be the best fit for you. Unless, of course, you only want to work as a per diem SLP where you can give the facility specific dates you're available to work. Per diem work will give you the flexibility you crave, but of course, this means you don't get benefits or guaranteed work when you go that route. Number 2, get comfortable with medically complex information. Medical information, especially when it becomes medically complex information, can feel like a new language. Working as a medical SLP means you develop a deeper understanding of how the entire body works and how things are connected, like how kidney function can impact a patient's cognition or voice, or how diabetes can impact swallowing, or how cardiac conditions and cardiac surgery can impact voice, swallowing, cognition, and communication. It doesn't stop at body systems and diagnoses either. MedSLPs need to develop a greater understanding of different types of medical procedures and equipment, like the differences between nasal cannula, high-flow nasal cannula, the venti mask, and endotracheal intubation, for example. Or how a tracheostomy changes the anatomy of breathing and swallowing, and how pressure systems are impacted. You might see C-collars, Doboff tubes, and G-tubes, PEG tubes, and different drains that require specific positioning precautions and nursing assistance prior to positioning a patient. On top of body systems, diagnoses, procedures, and equipment, medical SLPs need to be able to understand the potential side effects or outcomes of procedures and medications. For example, if a patient has had an anterior cervical discectomy and fusion, or ACDF, understanding how that can lead to swelling and impact swallowing, and which assessment and treatment strategies are appropriate is important. Or understanding how certain medications can impact swallowing or cognition could change your assessment or treatment planning. There's even a handbook called Drugs and Dysphagia, How Medications Can Affect Eating and Swallowing. Many medical SLPs will keep this handbook with them at all times. I have many memories of digging into research, textbooks, and discussion forums to learn about diagnoses I had never heard of before, particularly whenever I was assigned to a patient with a diagnosis or multiple diagnoses that I wasn't too familiar with. One thing I personally love about digging into medically complex information is the investigative work. If you enjoy problem solving and staying on your toes at work, you might love being a medical SLP, especially when your investigative work pays off and you get to celebrate major wins with patients and their family members. This could look like celebrating a patient's first bite of real food after several months, or witnessing your patient say "I love you" to their loved ones for the first time after a stroke or severe illness. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Also, do you have any specific questions about whether or not the medical setting is right for you? Leave a comment below and tell me about it. Make sure to stick around to the end to claim a freebie or two. Number 3. The final thing I'd like to encourage you to consider when it comes to whether or not you should be a medical SLP is your comfort level with direct and frequent communication with other medical professionals. Not everyone is comfortable with speaking up to doctors, nurses, and other medical professionals. One unfortunate reality of the medical setting is the sense of hierarchy that can be felt. I've had SLP friends tell me stories where they were instructed to never page an attending physician because it would bother that physician, so instead they had to find the resident or the intern. I've also heard stories where physicians challenged SLP recommendations or ignore their recommendations because there was a lack of trust and rapport between the SLP and physician. One common interprofessional barrier you'll hear about is the differing practice preferences between radiologists and SLPs during modified barium swallow studies. It can take some courage, advocacy, and strong soft skills to work with radiologists in the fluoroscopy suite who prevent you from completing the study the way you know you need to for your patient. Interprofessional collaboration and communication are required no matter where you work as an SLP, but some people might find greater discomfort and even anxiety when it comes to speaking up and advocating for their patients to other medical professionals, particularly when it comes to medically complex cases that involve large teams of professionals. This isn't limited to SLPs either. There have been cases of residents not speaking up to their attendings out of fear of being chastised in front of everyone. Historically, healthcare settings have run on what's known as hierarchical leadership, where certain roles are overemphasized and seen as more important than others. The great news is that we're seeing a shift away from this model and moving into something known as flat hierarchies, which gives everyone more flexibility and an equal voice. At the end of the day, we all handle workplace challenges differently, so knowing how you work best and who you work best with are critical keys to finding the right environment. Although the idea of speaking up, advocating, and working with a variety of medical providers can sound intimidating, there's also a great sense of joy and satisfaction that can come out of that. A lot of healthcare workers form a strong bond as they continue to problem solve together and serve the same patients. You can learn so much from other specialties, which can boost your clinical skills in unique ways. I've personally learned so much from ENTs and other doctors when working collaboratively with complex medical cases. At the end of the day, this decision is completely up to you. I will never tell you or anyone else what to do for their career, but hopefully these 3 considerations can offer a little more guidance in your decision making. As an SLP myself who transitioned from the school setting to the medical setting, these were some of the biggest lessons I had to learn quickly on the job, and I want to share them with others. Are you interested in learning more about the medical SLP life? I have several free gifts for you. First, go to MedSLPcollective.com and download one or both of the clipboard kits. These are collections of editorial reviewed PDF documents that provide education, templates, and resources for medical SLPs. Also, don't forget to check out the Swallow Your Pride podcast, where I host guests spanning from medical SLPs to researchers to physicians, and together we dish about all things medical SLP. Check out episode 88, where my guest Kelly Green talks all about how to transition to the medical SLP life the ethical way.